Welcome to the HEALWELL Podcast, where we explore the future of healing, shaping a healthier tomorrow, today.
Okay, so picture this, right? You're a doctor, you've got a patient, every second counts, but the information you need, like their medical history or something, it's stuck on a server miles away at your clinic.
Ugh. Talk about a nightmare scenario. That's exactly the kind of problem cloud-based EMRs are designed to solve.
Exactly. And that's what we're diving into today. We're taking a look at Intrahealth's Profile EMR.
But we're more interested in the bigger trends here. Why are these systems creating such a buzz in healthcare?
Right. We want the why, not just the what.
Exactly. And a big part of it is about removing those barriers, like in that scenario you described. A whopping 80% of providers say they have better access to data after switching to the cloud.
80%. That's huge.
It is. And it's not just about convenience, right? It's about having the right information when it matters most at the point of care, whether that's in a busy city hospital or a rural clinic, even a patient's home, or even, think about it, another country.
That's a good point. Our source really emphasizes this accessibility is king idea, and they use the example of like mobile healthcare providers.
Perfect example. Imagine a traveling nurse, maybe in a remote area, and they can instantly pull up a patient's entire medical history, allergies, medications, previous treatments, the whole 9 yards. Geography becomes less of a barrier to quality care.
Okay, that's a powerful visual, but let's talk practicality for a moment. Clinics, hospitals, they have budgets to think about. So how does this cloud dream become a financial reality?
That's where those potential cost savings come into play. Our source actually claims that 82% of healthcare organizations saw their IT costs go down after going cloud-based.
Wow, 82%. That's significant.
It is. Think about it, no more constantly needing to upgrade servers, deal with surprise maintenance costs.
It's like that old saying, penny wise, pound foolish. You think you're saving by sticking with the old ways, but...
But you end up spending more in the long run.
Exactly. It's like ditching your old, unreliable car for a ride-sharing service. You pay for the service, of course, but you're not burdened with the cost of ownership.
Makes sense. But healthcare technology, it's always changing, evolving at a rapid pace. So how do these cloud systems keep up?
That's the beauty of it. They're designed to. Cloud-based systems can push out automatic updates, so everyone's always on the latest version.
No more waiting for that one department to finally update their software.
Exactly. Our source actually cites a Gartner study that found a 30% boost in operational efficiency for organizations using automatic updates.
30%. That's significant. So it's not just about having the newest bells and whistles. It's about staying ahead of the curve.
Exactly. Healthcare is constantly evolving, and to provide the best care, you've got to evolve with it.
Now, we can't talk about storing sensitive medical data without addressing the big one, security.
Of course, the elephant in the room, especially with all the headlines about data breaches these days.
Right. People are understandably concerned about that. And yet, this is where it gets interesting. Our source states that 70% of providers actually find cloud-based EMRs to be more secure than their on-premise systems.
Wait, really? More secure? That seems counterintuitive. Help me understand that.
Think of it this way. Cloud security providers, they're like the cybersecurity fortresses of the digital world. They eat, sleep, and breathe data protection. They have entire teams dedicated to it, using those advanced technologies, constantly evolving their defenses. It's a level of protection that's really tough for individual practices to match, especially with limited budgets.
So it's less about building your own fortress and more about trusting your data to the experts who do this day in and day out?
Exactly. They have the resources, the expertise to implement really robust measures like encryption, multi-factor authentication, all those things that make it way harder for unauthorized access.
Okay, so we've got accessibility, cost effectiveness, constant updates, and strong security. But what about practices that are, going through growing pains? Can these cloud systems handle that kind of pressure?
That's where cloud-based systems really shine. Scalability is one of their biggest strengths. Our source highlights how these systems can adapt to a practice's growing needs, no problem.
So no more frantic calls to IT when you hire a new doctor or add a new department?
Exactly. It's about flexibility and agility, giving healthcare organizations what they need to grow without being held back by their IT systems. And that brings us to another important benefit: collaboration.
Because healthcare is a team sport, right? Doctors, nurses, specialists, everyone needs to be on the same page.
Precisely. And that's where cloud-based EMRs really excel. They help break down those information silos that can exist in healthcare. In fact, studies show these systems can boost collaboration and communication by as much as 40%.
40%. Now that's a game changer, especially when you think about how it could reduce errors and improve patient care. Can you give me an example of what that kind of seamless communication might look like in the real world?
Imagine a patient goes to see a specialist. Instead of relying on, faxed records or incomplete notes, the specialist can instantly access the patient's entire medical history from their primary care physician. Medications, test results, allergies, everything.
It's about connecting the dots, right, for more coordinated and effective care.
Exactly. And it's interesting because our source mentions that 75% of providers using cloud-based EMRs report better interoperability with other systems.
So it's not just a theoretical benefit, it's actually happening. What's the secret sauce? How do these systems achieve that level of seamless data sharing?
It's not magic, although it can feel like it sometimes. A lot of it comes down to how they're built. Cloud-based EMRs are often designed with interoperability in mind from the get-go. They use standardized protocols and interfaces, which means they can talk to other systems much more easily.
So instead of each system speaking a different language, they're all on the same page, sharing information securely.
Precisely. It's like having a universal translator for healthcare data. And this ability to share information so easily opens up some really exciting possibilities, especially when we start talking about data analytics and AI.
Right, because data is power, and healthcare generates mountains of it. Our source actually suggests that AI in EMRs could improve clinical outcomes by 30%. But paint me a picture here. How does this translate into real-world benefits for patients? Give me the elevator pitch.
Imagine a world where your EMR isn't just a static record-keeping system, but an intelligent assistant, analyzing your data to give you personalized insights. It could help predict potential health risks before they even become problems.
So it's like having a personal health detective working behind the scenes, constantly looking for clues to keep you healthy?
Exactly. AI can analyze these massive data sets, spot patterns, and trends that humans might miss. And this can lead to earlier diagnoses, more targeted treatments, even personalized prevention strategies based on your unique risk factors.
That's amazing. And speaking of personalized care, we can't forget about the telehealth revolution that's been happening.
Absolutely. Telehealth is here to stay, and cloud-based EMRs are a major reason why. Our source talks about how well Profile Cloud integrates with these platforms, and it makes sense. I mean, we've seen this massive surge in telehealth use, like a 38-fold increase since pre-COVID times, according to McKinsey & Company.
Those are crazy numbers. It really highlights how this isn't just a passing trend. It's the future of healthcare delivery unfolding right before our eyes.
It really is. And with a cloud-based system, doctors can access a patient's complete medical history during a video consultation, just like they would in person.
It's like bringing the doctor's office into the patient's living room, but with the added benefit of having this powerful EMR system at their fingertips.
Precisely. And it's not just about convenience. It's about making healthcare more accessible, more convenient, without compromising on the quality of care.
That's key. Now, all of this sounds incredibly promising, but let's be realistic for a moment. Implementing new technology, especially in a field as complex as healthcare, can be a daunting task.
I hear you. Change can be tough. But our source makes a really interesting point about future-proofing your practice. They cite a Deloitte study that found that 90% of healthcare executives believe cloud-based technologies are critical for staying competitive and compliant in this day and age.
Wow, 90% is a staggering number. That's a clear message.
It is. It tells you that in today's rapidly changing healthcare world, standing still is no longer an option. You've got to adapt to survive.
It's like the Red Queen said in Alice in Wonderland, it takes all the running you can do to keep in the same place.
Exactly. You've got to run even faster if you want to get ahead. And cloud-based EMRs, they're not just a nice to have anymore. They're becoming the industry standard. They're essential for healthcare providers who want to, improve patient care, streamline their operations, and just thrive in the years to come.
So to wrap up this part of our deep dive, it seems pretty clear that cloud-based EMRs offer some very compelling benefits for healthcare providers.
Absolutely. And while there are certainly challenges to consider, questions to answer, the potential for these systems to transform how we deliver and experience healthcare, well, it's undeniable.
It really feels like we're on the cusp of something big here.
We are.
Yeah.
And it's not just about the technology itself, it's about the people. It's about how we can use these tools to empower both patients and providers to create a healthcare system that's more patient-centered, more data-driven, and ultimately more human.
It's about using technology to make things more human, not less.
I love that. And it actually makes me think of something else our source talked about, telehealth. Remember that statistic we mentioned earlier, the 38-fold increase?
Oh, yeah, it was something crazy like that.
It really makes you realize this isn't just a pandemic blip, it's a sign of things to come.
Mm.
Makes you wonder, if we can have virtual doctor's appointments, what else could change?
What other parts of healthcare can we bring into this digital age? I mean, the possibilities seem endless.
They really do. I mean, take remote patient monitoring, right?
Yeah.
That's already taking off, especially for people with chronic conditions.
Makes sense.
It's like, imagine managing your diabetes or your heart health and sharing real-time data with your doctor, all through a secure platform.
That's amazing. No more waiting weeks for an appointment to adjust your treatment plan.
Exactly. And it's not even just about convenience. Think about people in underserved areas.
Right.
What if someone in a remote village could, consult with a specialist on the other side of the world?
It's like bringing top-tier healthcare to anyone, anywhere, as long as they have an internet connection.
Exactly. But of course, we have to talk about the other side of this. All this data sharing, it does raise some big questions about privacy and security.
Right. I mean, it's great to talk about how convenient it is to access your medical records from anywhere, but how do we make sure that information is protected?
You're absolutely right. And that's where this idea of shared responsibility comes in. Our source mentions things like encryption and multi-factor authentication, which are definitely important, but it goes beyond that.
Okay, so what else is there?
It's about choosing providers who really prioritize data protection. It's not just about the technology, it's about the policies they have in place, their protocols, their whole approach to security.
So it's like they need to walk the walk, not just talk the talk when it comes to data security.
Exactly. Patients need to feel confident that their information is being handled responsibly, ethically, and that requires transparency from providers. They need to be upfront about how that data is being stored, accessed, all of it.
It feels like this could lead to a pretty big shift in the whole patient-provider relationship, right?
Right.
One where patients have more control, more agency.
Absolutely. Imagine a future where you can easily access your own medical records, understand them, track your test results, maybe even research treatment options. You could even connect with other patients who have similar conditions, all in a secure online environment, of course.
It's like having this personalized health dashboard at your fingertips, 24/7. You're not lost in a sea of medical jargon anymore.
Exactly. And with the right information and support, patients can become much more involved in their own health care. They can ask better questions, advocate for themselves, and really work in partnership with their healthcare providers.
It's a win-win for everyone. Patients feel more empowered, and providers, they benefit from having, more engaged and informed patients.
Precisely. And think about the possibilities for research. With informed consent, of course, de-identified patient data could be incredibly valuable.
It's like crowdsourcing medical breakthroughs, but of course, always with those strong privacy protections in place.
Always. Ethics are paramount. But imagine what we could learn. We could accelerate the pace of medical discovery. We could find cures for diseases that have been around for centuries.
It's an exciting thought, but let's bring it back down to earth for a second. This all sounds great in theory, but how do we actually make these changes happen in a way that works, in a way that lasts?
That's the million-dollar question, right?
Yeah.
Our source makes a good point about this. They say the move to cloud-based EMRs, it's not a sprint, it's a marathon.
So you're saying we need to be in it for the long haul.
Exactly. It takes planning, collaboration, and a willingness to adapt as we go.
And we can't forget about the human element, right?
Yep.
We need to make sure healthcare providers have the training and support they need to use these new systems effectively.
100%. Technology is only as good as the people using it. We need to empower providers, make them feel confident and comfortable.
It's about finding that sweet spot, where cutting-edge technology meets human expertise, where we can use these tools to create a healthcare system that's both highly advanced and deeply compassionate.
Now you're talking. That's a future worth striving for.
It's that human element that makes all the difference, right?
Yeah.
And it ties into something else our source talked about that I wanted to circle back to, this idea of data as power.
Oh, I see where you're going with this.
They talk about AI being used to personalize treatments and all that, which is amazing, but what if we could empower patients with that same data, give them more control?
Now, that's an interesting thought. I mean, imagine if you could log into a secure portal And not just see your medical records, but really interact with them. You could track your health metrics, see trends, maybe even do some research on potential treatment options, connect with other patients who have similar conditions.
Wow, it'd be like having this personalized health library and support group all rolled into one. No more feeling powerless or confused when you're facing a diagnosis.
Exactly. Knowledge is power, right? And when patients can understand their own health information, they can be much more involved in their own care. They can ask better questions, advocate for their needs, and make more informed decisions in partnership with their healthcare providers.
It's like shifting that dynamic from a passive patient to an active participant working together.
Exactly, a true collaboration. And this shift towards patient empowerment could have huge implications for medical research, too.
Yeah.
Imagine if, with informed consent, of course, we could aggregate de-identified patient data from all these cloud-based systems.
You'd have this massive pool of information ethically sourced that could lead to some incredible breakthroughs.
Exactly. We could see patterns and trends that might be impossible to spot in smaller studies. It's like,
Crowdsourcing the future of healthcare.
yes. And not just about finding cures either, but also understanding the nuances of different conditions, tailoring treatments more effectively. It's about moving towards a healthcare system that's more precise, proactive, preventative, all of it.
Shifting from a reactive model to one that's truly focused on keeping people healthy in the first place.
Exactly. And as we wrap up here, I think that's a really important takeaway. This isn't just a tech upgrade we're talking about. Cloud-based EMRs have the potential to fundamentally change how we approach healthcare.
It's a whole new way of thinking about it, delivering it, experiencing it even.
Absolutely. It's about empowerment, collaboration, and a much deeper understanding of what it means to be healthy in this digital age.
Well said. And, while there are definitely challenges ahead, like making sure everyone has access to these technologies and that data privacy is always protected,
Of course, those are important considerations.
I'm still incredibly optimistic about the future of healthcare. It feels like we're on the verge of something truly transformative.
I agree. It's an exciting time to be in healthcare, that's for sure.
It really is. So, to our listeners, as you go about your day, we'll leave you with this thought. If knowledge is power, how might these cloud-based systems, with all their potential and complexities, change the relationship between patients and providers? How can we use them to give individuals more control over their own health data and their healthcare journeys?
It's a question worth considering as we venture into this new frontier of healthcare.
It certainly is. Thanks for joining us on this deep dive.
My pleasure. Until next time.